I didn't become a nurse coach because I stopped believing in medicine. I became a nurse coach because I saw what happens when prevention comes too late. I spent years working as an ICU nurse, and honestly, one of the hardest parts of that job wasn't the long hours and all the chaos. It was watching people fighting for their lives. Because chronic disease, in many cases, can be prevented or better managed years earlier. Every shift, I would leave asking myself the same question. Why are we waiting until people are this sick before we even talking about a prevention? That's why I became a board-certified nurse coach, because I would rather help people stay out of ICU than taking care of them once they're already in there. I think we built a healthcare system that is incredibly good at treating disease. But we don't spend nearly enough time teaching people how to build health. By the time someone is diagnosed with type 2 diabetes, high blood pressure, fatty liver disease, these problems are often been developing quietly for years. Now, before anyone misunderstands me, medication does save life. I've seen that with my own eyes, and I'm incredibly grateful for it. But medication often help manage the consequence of the disease. They don't always stress the root cause and why the disease developed in the first place. So if poor nutrition, chronic stress, lack of sleep, and insulin resistance all contributed to the disease, shouldn't improving those things also be part of the treatment? Instead of asking only, what medication do I need? Maybe we should also ask, why did this happen? What changed? What can I do to help my body heal? I mean, every medication has a potential side effects. Sometimes those side effects are absolutely worth it. Sometimes medication is exactly what people need. But what if we can improve our health enough to reduce our dependence on medication over time? Isn't it a good goal worth pursuing? A diagnosis tells you where you are. It doesn't always tell you where you have to stay. Your body is not broken. More often than not, it's responding to the environment it's been given. So food matters. Sleep matters. Stress also matters. That's exactly why I became a nurse coach. Because I would rather help people build health today than meet them in the ICU tomorrow.